Hello again, this is Dr. Jerry Cuomo. I'm here with a case that I reviewed earlier, I want to say probably earlier in the year. Now I'm just getting back to observing the case, and we're going to finish this. And this case presented with a crown that needed replacement, but more importantly, there was an area of bone loss at the tip of the root from an old root canal. So we were successful at removing the crown and removing the post, and there is a video on that. Here is the post that was removed, and this is the pre-op x-ray of that tooth. It's number 19. This is after the endodontics was performed, prior to bone fill. Periodontally, he's within normal limits, and continued success here with the final bone fill and endodontics. So today we're going to go ahead and take off the temporary crown, place retraction cord, get our impression, and have our patient back in about 3 weeks to put in the final. The rationale behind this, I know the argument is, well, why not just take the tooth out? Well, the patient did not want to go through implant therapy or have a 3-tooth bridge, so we stayed with form. It did take us a little while to get this removed. The endodontist tried, couldn't remove the post, so we were successful using the Leica expanding images Leica Microscope, and things worked out fine. So we're going to go from radiographs here, which is basically printed on a piece of paper, to our patient who's been waiting patiently for a while. Alright, we went ahead and loosened up the temporary. I'll take that out now. Again, I used Durlon cement. This has been in his mouth. I'm estimating 2-3 months, waiting for the bone fill, maybe even longer than that. Alright. Okay, so it's been in a while, so we're going to go ahead and apply cavity cleanser again. We're going to just go around and scrub this tooth. The buildup is in place. Basically all we have to do is get an impression today. I had a little food in there, but this is all unedited. We're just going to go right to our next steps. Now we're going to place a retraction cord called Siltrax 7, impregnated and washed with Hemodent. Small amount of epi, but we'll also rinse that away as well. So. You okay? Everything good? Yep. All right. I'm just going to put some cotton on each side of our tooth. Now we're going to scrub that area with a topical anesthetic. Again, we're going to try to do this without numbing our patient, and he seems to be doing pretty well so far. I'm going to give you a little saliva ejector here. And a 2x2 gauze. Clinically, the patient did not report of having any more symptoms on this particular tooth, so we're symptom-free. We're now basically going to go through and place our retraction cord. Before I do that, I'm going to paint with the topical anesthetic. And this one is called Cytokane or Cytokane. And just go around the gum line a few times. And we'll do that again. This way my patient doesn't feel it. And if you do feel it, just let me know and I'll numb you for it, okay? Alright. We'll rinse all that off. And then we'll change out the 2x2 gauze. Right. Okay. You okay? Good. A new cotton roll. Alrighty. Sorry. Go ahead and close. Swallow. Need some water? You okay? Okay. Now you can see the tissue is somewhat edematous here, especially on the distal lingual aspect, but that should recover quite well once we reline the temp and get the margins to be more prominent in that area. We kind of knew going in that we were going to be subgingival a little bit, but should have no problem here. He's got a little slight early furcation involvement. We'll barrel in that facial aspect with our prep. How we doing? Okay? And we'll take the microsuction now. Now I'm going to use both of my hands on this. I'm going to use a microsuction in one hand. I'm also going to continue to place retraction with the Siltrax. So we'll have a little small retractor right here, like a little mirror. It's right here. Great. Okay. So suctioning behind and drying up any curvicular fluid. So the braided cord will stay right where it's placed. I just love the microscope. You can see things much more clearly. Okay, so now let's switch to indirect vision as I turn the corner, switching off. Okay, so there's our distal margin, and Siltrax being tucked down past that margin. Alright, so distal lingual, a little more subgingival, a little hypertrophied soft tissue there, which hopefully will shrink with time. And tell the old temporary is kind of worn, so we may go with a new one. We'll have to decide that in a little bit. We've also instructed our patient to not only floss brush, but to use a water pick. It's important to use a water pick in these areas, so we'll reinforce that today. Alright, as I normally do, I just go ahead and separate and I'll just take one of the ends and cut it, and cut the next. Great. And now the next step. We're up about 5 power of, actually we're up to 8 power. So this is well beyond loops. Why have loops when you can have a microscope? Microsuction. And we'll just push this one. We actually can use the, this is a 20 gauge suction. We can also go down. They have them even smaller than this. If you want to pack cord with the suction, you know, like kind of like what I'm doing here. I'm pushing it down and vacuuming at the same time. Now I can see where I want to improve my margins. Try to keep it in focus for you. It's pretty good. And we'll do once around later with another cord, more of a 2-ply Gingipack cord. Alright, so this is rough in here. I want to get that furcation looking better. This margin needs to improve, and all the way around. So I'm going to go ahead and do that. Just wanted to show you how successful we made it with the use of a dental microscope. And Pierre will have his final restoration coming up. Long term looks good. It's guarded, but it looks good from here. This is Dr. GERARD CUOMO. We'll catch you on the next video clip. Thanks for watching.